From the north to the south of the country, public hospitals are deserted and even doctors are tired of waiting. Yet, they are determined to have their demands met and insist that the federal government is being insensitive to their plight.
This strike has been painfully very successful. Painful because look, we're always dealing with human pains and lives. It's been a little more successful than anybody expected, mainly because this time it was the people who always argued against strike that are calling this out.
The House Committee on Health invited the Minister for Health, invited the Minister for Finance, and the Minister of Labour. It was only the Minister of Labour and the Minister of Health that were present. All it takes is for people to send directors there who cannot take decisions on this issue.
Both parties signed, so we thought that was a good agreement, but they reneged on it and insisted they would go on strike. Government being backwards, sat with them again for 10 hours, making a total of 24 hours. Another MOU was signed, and we thought, okay, now, thank good God, this was all over. And again, they've reneged on it. I think it has to do with this rivalry, as it were, with a non-physician group in the health sector.
A cross-section of people expressed concern that the strike has gone on for too long and doctors should think of others besides themselves.
If you get into the hospital, you see a lot of patients lying critically ill, and some of them who had to see specialists didn't have the opportunity to see specialists. Some of them have also passed on.
Everybody needs hazard allowance because every health worker is in one form, is undergoing one form of hazard in his or her duty. So I don't see it as a doctor thing. If they are fighting it as a joint health worker thing, then it's okay, but doctors alone cannot be fighting for hazard allowance.
Yet the striking medical practitioners insist that their fight is also for the man on the demonstrated this. The disease first broke out in 1976 near the Ebola River in the Democratic Republic of Congo. But this is the first time it's been experienced on this scale. In spite of this seemingly despairing news, if vigilance is exercised, one can avoid getting it.
There is the concern about Ebola being airborne. It is not airborne. If someone has Ebola and is talking to another person, that other person is not going to catch the Ebola virus. Contact is very critical. Contact of the sick person. You can't catch Ebola in the market because that person will not be able to walk. The person is really, really sick. So they won't go to the barber's shop. They won't go to the beauty salon. They won't come and do manicure and pedicure. They will not go shopping. They are very sick, in bed, can't move.
There are a couple of symptoms that would give Ebola away.
He has fever, you don't know that it's not malaria, and then by the time you know where you are, you have contacted it. So I think we should all be on the alert. And then report or go to the hospital whenever there is fever, especially severe fever associated with bleeding. That is what gives it away. Fever associated with bleeding. Bleeding into the gums, bleeding under the skin, bloody diarrhea. If you have any relation with that kind of symptoms, I think this is best taken to the hospital.
Precautions are rudimentary.
If you can wear gloves, better. Gloves. If you can't, then wash your hands. But there's really nothing to panic about.
Nigeria's first case of Ebola arrived in the form of 40-year-old Patrick Sawyer, who came in a work-related capacity. He died of the disease after several days, but Lagos health authorities say all who came in contact with him are under surveillance and are still healthy. The question remains, how prepared are we as a country to handle this onslaught? And can we beat the scourge that kills 9 out of 10 sufferers?
We've increased our surveillance and vigilance at the airport, and we're doing extra things to make sure that anyone that's coming in, we can track them regardless of where they're going. And I know that the federal government has instituted programs at Abuja Airport and Kano Airport and all the other ports.
The incubation period for Ebola could be as short as 2 days or as long as 3 weeks. That means that sometime in the second week of August, we'll know if we beat this invasion. But in the meantime, remember this: Ebola can only be spread by an obviously sick individual. Mary Alale Yusuf, Channels Television News.
Well, Dr. Simbo Davidson joins us now. She's a public health specialist and also the health system administrator, a certified quality management practitioner. Thank you for coming on this morning.
Thank you, sir.
We're just talking about this second week of August, where
That's
how
right.
long we have to wait to see if there's any outbreak anywhere. So that means that we wait that long. If there's no reported case, it means there isn't any indigenous case of Ebola. As far as the Liberian who was here died is concerned, is that the case?
Well, that will be the case. That means we do not have any contacts that have come down with the disease. It does not mean that we do not have any cases in the country. He came on an airline that has been flying people into Nigeria for the past 5 months. And we have people traveling to Liberia by road, traveling to Sierra Leone by road. What's going on? We don't screen anybody at the borders. So we have a lot of people going in and out of those high-risk areas, and we haven't been able to stop them from doing so. And we do not have a good surveillance outside of urban areas, that's the truth. And we cannot categorically say that we do not have any cases right now in the whole of Nigeria, because it's the cases that get reported that you can say this is a case. Even in the high-risk zones right now, Sierra Leone and Liberia, I can say, for instance, that probably there's a lot of underreporting because some people don't get to hospital. They just find out, oh, this person is sick, let me just try, maybe if it's Ebola, I don't care. And then the person dies, I bury the person in my compound. So lots of cases don't get reported. And we know this, even in Nigeria, lots of cases don't get reported. So right now, I am not totally confident that we do not have any cases at all. But definitely the reported cases, we do not have any. And we hope that within 21 days, we don't get any contacts who have.
Because one other area that we need to do something about, and fast too, is the land borders.
Oh, yes.
Because, I mean, they talk about the infrared scanners at the airport. That's right. What about the borders? So that's a big question.
Yeah, it's a big question because we do have to have a proper strategy. And I think this is where we need to look at what needs to be done at the borders. Who needs to be trained at the borders? What sort of screening can we do at the borders? And what we have at the borders are just custom officials. We don't have medical people standing around there. We don't have people who are definitely screening those who are coming in and going out. We need to set up some kind of surveillance at the borders. And we need to have trained people, not just customs officials.
But how feasible is that? I mean, considering the number of people who will be going and coming, and then also considering smuggling activities, we never can tell.
You're right. You can't get 100% coverage, but you can get something. And I think even what the airlines were doing a couple of weeks ago, they were just checking the temperature. It's just something simple like checking the temperature of the person and having a good look at what the person, you can't obviously screen everyone. And if you want to go further, anyone who has a temperature, you can say, sir, can you step this way, sir? And you have your rapid testing kits. What's happening to the kits? Lots of people don't have those kits. Even the private hospitals don't have those kits.
We understand there is no rapid test kit.
There is a kit. There is a kit.
Ebola.
It may not be so rapid, but there is a kit. And there should be some sort of mini lab, centers everywhere right now, along with the isolation centers. We should have set that up right now. Do we have that in place? I don't think we do. We ought to have isolation centers, right, designated ones. And those ones are not health centers that see normal people. They shouldn't be. Because if I say this is a normal clinic day, okay, and tomorrow is isolation day.
They have, I understand that they have one in Yaba. There's a
okay, that's just one. We need one in every local government if possible. Because if I lived down at Ekpe, I'm not going to carry somebody to an isolation center 10 kilometers, 20 kilometers away. It's probably not, going to be feasible for me. So that's what happened in all the other countries. They don't have the centers, located where people can actually get to them. It's got to be better planning. We've got to have places that people can go, in their neighborhood. Okay, I'm thinking I'm sick. I'm going to go there. Okay, what's happened? Just noticed some fever and vomiting. Oh, really? All right, let's test. And then there's a mini lab in there, they're testing right away. But when you say, oh, we have to send a sample to Lu, this is not good planning.